The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, and welcome to today's educational webinar brought to you by Physician Partners, the Physician Resource Center, and the California Medical Association. My name is Dustin Brown. Just a couple of housekeeping rules. Everyone is muted during the webinar to avoid any background noise interference. Please, however, feel free to enter any questions that you have along the way using the GoToWebinar interface tool. We'll go ahead and answer all the questions at the end of the webinar. Today's presentation topic is on Cal MediConnect. Before we get started and I introduce our presenter today, we have a few poll questions for all of the attendees to answer. This will just take about 15 or 20 seconds per question, and we'll go ahead and put up the first one right now. The first one is, must I have my MediMedi patients sign up with a dual plan with which I participate in order to continue to see them? So if you go ahead and answer yes or no on that, we'll give you another 10 seconds here. Okie dokie. We'll go ahead and move to the next poll question. And here it is. Do I need authorization to see a patient with fee-for-service Medicare but enrolled in a managed care MediCal plan under CCI? So again, yes or no on this one. We'll keep this up for another 10, 12 seconds. Okay, very well. And we'll move on to the last question. Must I contract with the managed care MediCal plan in order to see a patient who has opted to retain fee-for-service Medicare? Again, yes or no. And we'll leave that up for another 10, 12 seconds. Now, at the end of the webinar, we'll go ahead and present the answers to these poll questions for everybody to see, okay? So we'll begin now. Thank you very much for answering. So today's presenter is Dr. Ted Mazur. In addition to showing the slides that you currently see, the CMA slide on the screen right now, we'll also be turning on a live video feed of Dr. Mazur during the broadcast, so that'll start shortly. A little bio on Dr. Mazur. He's a board-certified solo otolaryngologist in San Diego. Since residency training at Baylor College of Medicine, he has practiced here in San Diego for the past 27 years. In addition to a busy otolaryngology practice, he has been involved in patient and physician advocacy through organized medicine, serving previously as the president of the San Diego County Medical Society for 18 months, and presently as the speaker of the CMA. He has also served on the boards of several local IPAs, including Physician Partners, for many years serving as medical director for East County Physicians Medical Group, and subsequently for the East County Pot of Mercy Physicians Medical Group. He has been on national advisory councils to payers on behalf of the CMA and does third-party review for independent review companies and at times for Medicare carriers. In addition, he has been involved in lobbying in Congress and CMS, as well as in litigation to protect physician rights and access to care, including being involved in 2 cases presented to the U.S. Supreme Court. He is a local and national media resource for medical and medical political matters, appearing on not only television, radio, and newspaper articles, but having been seen in the LA Times, New York Times, and other national papers, as well as on the Megyn Kelly and Neil Cavuto shows on CNBC. So with that, thank you, Dr. Mazur, for being our guest presenter today.
Thank you. And are we on?
You are on.
Oop. Okay.
We'll go ahead and just bring it back there.
We have a little technical glitch. Stay with us.
There you are.
All righty. And thank you all for attending today. I was watching the answers to the poll questions, and it looks like we kind of need this lecture today. I want to thank the California Medical Association. They provided some of the slides here today, as well as partners for hosting this, and in particular, 3 people and 2 centers at the CMA, the Center for Medical and Regulatory Policy with LaShawn Francis, and the Center for Economic Advocacy, which if you are CMA members, you can use for matters concerning the CCI program or other issues affecting your practice by contacting either Jody Black or Chris Mark, and I can give you that information if you'd like on how to contact them. So today we're going to talk about the CCI, or Coordinated Care Initiative, as opposed to the Correct Coding Initiative. Same initials, totally different subject. This is also known as the dual eligible program, or in California, Cal MediConnect. This is a federal pilot program of which we in San Diego, for better or worse, have the privilege of being one of the pilot counties in California. The map there shows you the state of California, and the dark blue counties are the counties that have already been started or were supposed to have been started in the CCI program, which takes dual beneficiaries, those who have both Medicare and Medicaid or MediCal, into an option of having all of their care coordinated through a single program called Cal MediConnect. That makes them both HMO for Medicare and MediCal services, and extends some of those services for long-term and home care, as well as DME. The concept behind this pilot, which is occurring in several states, is that by coordinating care for some of the most vulnerable population, we would hopefully see better care, better outcomes, and save money. The latter part in California is so far not coming true, and will probably result in the termination of this program if something doesn't change over the next year. The program started last year with a mandatory, by the state of California, enrollment in Medicare-MediCal, and an optional, although an opt-out system for enrolling these patients in managed care HMO for their Medicare benefits. What that means is that you as physicians and the patients as recipients have no bloody idea what they're supposed to do. And that's why we're here today to talk about it. Originally, it was supposed to be 4 counties. That was what was approved by the federal government for the pilot in California. The state of California then advanced to 8 counties, and the governor actually, by the end of this year, wanted it to be the entire state. California Medical Association pushed back and reminded the federal government that, hey, this is a pilot, and enrolling 400,000 beneficiaries overnight is not a pilot program, nor is enrolling the entire state, where managed care doesn't even exist in much of the state outside of the urban areas. So it has now been pushed back to 8 counties. As you see, San Diego is the largest currently running county, because counties like Los Angeles are having trouble because their managed care MediCal programs have been under federal investigation. So they've not really rolled out yet. They're about to. In San Diego, there are 4 payers that are involved in this plan: Molina, Care First, Community Health Group, and HealthNet. Those are the programs that will see the patients under both their HMO Medicare and HMO MediCal if they are enrolled in the Cal MediConnect program. The program is supposed to expire as a pilot in January of 2017. The legislature here in California and the governor's office have said unless it can be shown to be saving money, they have no intent to continue it. Some of us believe it's already shown not to save money and not to improve, but rather hurt access to care, and have been trying to work with the federal government to say maybe this shouldn't even go that long. But for right now, it is here and it is staying. We lost our E equals MC squared slide. It didn't come up. What you see is what became the Coordinated Care Initiative, another name nationally for Cal MediConnect here in California. The mandatory managed care enrollment for MediCal was approved by the federal government, but when the California governor wanted to have a mandatory enrollment in the Medicare portion, we pushed back on that, and actually CMS said, no, you can't force federal beneficiaries to be in an HMO if they don't want to. They have the option not to be. And that's where the confusion arises, but it also continues to allow access for you to see some of these patients and for the patients to see you. The Coordinated Care Initiative add-on is the Managed Long-Term Support Services, which did not exist in the old split program. And the Cal MediConnect is when the patient has enrolled passively or actively into a program that gives both their Medicare and MediCal benefits to the HMO entity. This slide's a little bit busy, but let me try to take you through it. And these are the important things that you need to know. Under Cal MediConnect, the dual beneficiaries have the option to receive Medicare and MediCal benefits through a single health plan called Cal MediConnect, controlled by these 4 health plans that are operating them. And that does offer some additional benefits. In MediCal managed care, the dual beneficiaries can choose not to join a Medicare HMO. So they are not part of Cal MediConnect, but because they are duals, they will be mandatorily enrolled into a managed care MediCal plan secondary to their fee-for-service plan in Medicare if they continue to see Medicare fee-for-service. The patient has been sent, and there are more people being enrolled this year as well. They're being sent at least 3 notifications by the state of California in several languages with an option to not be enrolled passively into Cal MediConnect. Many patients don't understand it, they throw it away, and unfortunately some of our doctors have been giving them false information as well, which was one of the poll questions, that you do not have to have the patient enroll in a plan with which you participate to continue to see them if they wish to remain in the Medicare fee-for-service program. But your patient does have to take proactive role in staying in that plan. I want to caution you not to tell a patient to stay in managed care Medicare, in fee-for-service Medicare. That would be a step too far, and we've been slammed in the press for that already. But you are certainly able to tell your patients that they have the option by calling numbers that are sent to them, like by talking to a social worker. But the easiest way is to tell them to call 1-800-MEDICARE, pretty easy to remember. Tell them to call 1-800-MEDICARE if they want to stay in the fee-for-service open Medicare program, and simply say, I do not want to be enrolled in Cal MediConnect. They can then choose their Medi-Cal secondary managed care plan or let the state assign it. And as we'll get into, it doesn't really matter how that process proceeds. If your patient opts out of Cal MediConnect and only has a managed care Medi-Cal plan, you do not have to contract with the Medi-Cal managed care plan to see the patient. The patient still is a Medicare beneficiary with open access to any Medicare physician, just like they were before. If there's a deductible or co-insurance payment due after the Medicare payment, and we both know that that's hardly ever the case, except at the beginning of the year for the deductible, Medi-Cal does not pay the 20% copay on most services, although there are some services that Medi-Cal pays for that Medicare doesn't. We'll get to that in just a minute. When you bill Medicare just like you did before for these patients who have a managed care Medi-Cal enrollment, but you are seeing them through the old Medicare program. The claims are paid by Medicare, and then they should automatically cross over to the Medi-Cal entity. There's one caveat I'll give you here. Don't trust that, because a lot of times those crossovers are not happening, at least not yet. We are working with both the state and the federal government to make sure those occur. What I would tell you, if you're going to do this and continue to see these patients who've not chosen to go into the managed care program or are not with a program that you don't participate with, make sure that your billing cycle includes watching for the secondary payments, because you may have to send a paper claim or an electronic claim, if you're able to do that, to the managed care entity to get that deductible payment or anything that Medi-Cal might otherwise pay. But the bottom line is you do not need authorizations to see a patient in the managed care Medi-Cal program, in the dual program where they have fee-for-service Medicare, and the managed care entity is obligated to pay you as the state of California would have. You may need to do a little extra legwork, but you can get those payments when they're due. And again, we know after the deductible period, they're hardly ever due. There are some services for which Medi-Cal pays and Medicare does not. And for those things, you would need an authorization. So you would have to contact the secondary entity, the managed care Medi-Cal plan, to get that authorization. They may deny that if you are not contracted with them. So that's the one caveat, but it's a pretty rare circumstance to worry about. Again, the most important thing is you need not contract with the managed care Medi-Cal plan to receive the coinsurance and deductible payments for a patient who remains in the Medicare fee-for-service program and is a dual eligible. Remember, as in every other thing, we have to check the eligibility at the time of visit. I'm going to show you some of the pitfalls here. This is from the AEVS system or the AVE system. If you are a Medi-Cal provider in any way, you should have one of these in your office, or you can go online and get the same information. You put the patient's social security or their Medi-Cal number into the system, and it will spit back the page that you see in front of you blown up in the center. This is a patient who is on Cal MediConnect. And when you go to the AEVS system, it will say health plan member, either CareFirst, CHG, Medi-Cal, or HealthNet, Cal MediConnect. This patient does not have fee-for-service Medicare, according to the state of California, if they're right when you're doing this, because a lot of times we're finding errors in the AEVS system. And just last week, I was in Washington talking to the new head of Medicare, Andy Slavic, about this very issue, and they're looking into making sure that the state enforces the accuracy of this kind of system. In the next example, This is someone who is a dual beneficiary who has opted out of the managed care Medicare portion. They've opted out of Cal MediConnect, but they have been assigned to Molina, either voluntarily or passively, as their secondary payer for the Medi-Cal program. So what you see here is on the Medi-Cal portion, it says health plan member, Molina Healthcare, but then it says Medicare Part A and B covered services must be billed to Medicare before billing Medi-Cal. Again, this is a fee-for-service patient. You bill Medicare, you get paid the same way you used to get paid by Medicare, and then the claim should cross over, but make sure you have a secondary check to Molina. They should pay any deductible, and if there is any copay due, then they should pay that as well, even if you are not contracted. Make sure you understand you do not need to be contracted with Molina to get the secondary payment for a patient like this. The last example, there are still fee-for-service Medi-Cal patients, and they may be dual beneficiaries. There are several populations that are excluded from the mandatory enrollment. This is what it has always looked like, continues to look like. It tells you that they are Medi-Cal, they have Part A, B, and D Medicare coverage, bill Medicare first. Those claims will automatically cross over. You need not worry about downstreaming and checking whether or not that's gone through. Now, in terms of checking eligibility, there are several ways to go about finding out where this patient is enrolled and whether they are fee-for-service or managed care Medicare HMO. The state system, as I have mentioned, is not always accurate. It's a good place to go, and you can then use that if you have to appeal later. My recommendation is that you also have your staff, and this is very quick, your staff can go onto the Noridian site for providers and simply put in the Social Security Medicare number. They will get an immediate printout that is real as of that date. It's much more accurate than the AVS system. And it will tell you right at the top whether the patient is HMO Medicare risk or they are eligible Medicare, which means fee-for-service Medicare. That piece of paper is probably your more important paper than the AVS system at this point in time. Again, we're trying to make sure that that's corrected. The plan here is to make the state responsible for the AVS system. If it's wrong, the state needs to be responsible for payment, and we are working those angles. The third part is a little bit more difficult if you are not contracted with any of the managed care Medi-Cal entities, either for their duals or just their Medi-Cal patients, and that is to go to their eligibility site and make sure that the patient is current. Again, we're finding problems with those websites, but if you have the access to that and it says they're eligible or they're not eligible, print it out because that's your defense in an appeal. The most important one from my perspective is get that printout from the Noridian website. If it says that patient that day is fee-for-service, you will be paid by Medicare. They'll go back and take care of that, from my understanding, talking with Medicare entities. Okay, so if you are out of network with the managed care Medi-Cal plan, can your patient still see you? Yes. If your patient is with the traditional Medicare program, they can continue to see any Medicare provider regardless of the status of their Medi-Cal as HMO or fee-for-service. The coinsurance is paid by the Medi-Cal managed care plan for what Medi-Cal would have paid you, not much usually. There is no authorization necessary. Here again, I will give you one caveat, and that is if you're doing something beyond an office service or a minor procedure, it would behoove you to check with the managed care plan. If you're taking somebody to the operating room, just clarify on the day before surgery that that patient is still enrolled in the fee-for-service Medicare plan. Protect yourself and your patient. So what happens if a patient has a complaint? First of all, you need to make sure you haven't given them reason to complain by trying to get them to do something they don't need to do. When this program came out, a lot of docs were saying, look, you have to sign up with this group because that's the only way I continue to see you, because that's where I have the managed care Cal MediConnect plan, and I don't have it with any other entity. Again, as I said before, that's not quite true, and it's confusing patients, but the doctors themselves were confused and continue to be confused. Your role really is to educate the patient to their options. You will be passively enrolled in Medicare-MediCal HMO if you do not take action. If that has already occurred and you want to go back to the fee-for-service Medicare system, call 1-800-MEDICARE or call the state program. There's an ombudsman's number that you see in front of you, and just tell them, I want to get out of the managed care Medicare portion, and they will do that effective the first of the next month. We've had some cases where patients were enrolled without their knowledge in the middle of a month, and we've had that unwound back to the first of the month. So you can get some of these things corrected. If the patient wants to enroll in Cal MediConnect to get some of the other benefits, and frankly, if they're having home health care and things like that, there is a benefit for them, then you need to inform them whether or not you can continue to see them or what plans you might participate with that they should sign up with if they wish to continue to see you. These numbers here are other places for the patient to file a complaint. If you have a complaint about the way a patient is handled or the way you've been handled by a health plan that should be paying a secondary or had erroneous information available, if you're a member of the California Medical Association, you can contact the CMA directly and they will help you through the Economic Services Division. You can contact me if you've got some questions about how to do that. I'm a regular with them. They know me well. And finally, if you have anything beyond that, you can contact the Medicare office through Noridian, and you'll get an advocate to help you in that as well. And at that point, I will leave this open for questions. Again, there are resources to help you. I'm happy to work through partners and help you navigate through this. The California Medical Association has lots of resources for you, both print and online, and things that you can give your patients in numerous languages to help you and them understand this program. I have been operating in this program now since its inception. I accepted contracts with two, not all four, but two of the plans, and have had very few problems once we've established proper eligibility. I have had a lot of questions from patients, especially those who have been put into the Cal MediConnect program and didn't realize that by throwing away or not responding to the mail, that's what happens to them, and about half of them have unenrolled. Statewide, we're seeing between 65 and 70% of patients who have been enrolled or actively or passively enrolled in Cal MediConnect back out of the program, which is one of the reasons why this looks like it's going to be a failure of a pilot. They don't like the limited access that they're getting when they give away their Medicare card. So I'll stop there, and I'm happy if you have any questions.
Yeah, let's go ahead and look and see what. Thank you very much, Dr. Muser, for the presentation today. Let's see what we have here. Okay, the first question we have here. The first example said the same thing. Let's see. Can you review the printout that clarifies the type of Medicare fee-for-service HMO?
Sure.
We can go back to this then. Okay.
So the type of Medicare HMO that I think you're talking about what happens if they're in an HMO plan. Can you bring the first example?
Yeah.
I want to see what the question is again. So
the first example said the same thing.
Great, but now can you review the?
Oh, there we are.
The printout that clarifies the type of Medicare fee-for-service HMO.
Yes.
Okay.
Yep.
So here's the three variations that you might see. The first one is someone who has been enrolled in both HMO Medicare and HMO MediCal, which is Cal MediConnect, and it will state the health plan member is in the Cal MediConnect program, and it will state which health plan. One thing it does not state, and this is a big problem that we've been working with the Department of Healthcare Services in California for a long time. It doesn't say, for instance, in this case where it's Care First, it doesn't say if it's Care First with a medical group like Vantage Medical Group or Multicultural Medical Group or another medical group. But the bottom line here is when you see this, you need to find that information out. If you are not contracted with Care First through any entity to see the Cal MediConnect patient, do not see this patient. You will not be paid for your services outside of an emergency condition. But if you are contracted, you will need to have your staff go, and they should have access if you're contracted, go to the website for Care First or Molina or CHG and determine what group is this patient assigned to. For me, I'm in the direct network for Community Health Group, for instance, but I'm not with Vantage Medical Group, and sometimes we can't tell the difference till we get to the website. And unfortunately, we have to tell a patient, I'm sorry, you're enrolled with a group that we're not contracted with. Hopefully that answers the question on what this one looks like.
All right. The next question, the first eligibility slide showed bill Medicare first, as did the second, but this did not.
I got that question. This is the same slide, and you are correct. And that's why we've highlighted for you when it says Cal MediConnect, it is Cal MediConnect. This is one of the problems with the AEVS system that we have forwarded to the federal government to look at because the state of California has done nothing to correct it. So if it says Cal MediConnect, it is Cal MediConnect. They are not fee-for-service Medicare.
Okay. Next question. If a patient has Medicare fee-for-service Part B only with MediCal HMO, do they require authorization for the inpatient stay for the hospital, or is an authorization still not required from the HMO?
That's a really great question, because when they have only Part B, they're only going to get their Medicare fee-for-service coverage and the guarantee of payment of the secondary for Part B services. If that patient requires Part A services, they are actually only receiving their managed care Medi-Cal benefit. And if you are not contracted, don't take them to the hospital, again, outside of an emergency. And if you are contracted, yes, you will need authorization.
Next question, can you clarify Cal MediConnect needs a referral and for us to be contracted with the secondary provider?
Okay, if the patient is Cal MediConnect, you must be contracted with that Cal MediConnect provider or with an IPA that is also seeing that Cal MediConnect product. You must be contracted with one or the other to see that patient. They do not have any fee-for-service benefits left. Therefore, if you're a specialist, they do need a referral from either the IPA or from the entity itself, CHG, Molina, Health Net, or Care First. And then, yeah, so they're not really the secondary provider. They're the primary and secondary provider.
Next question, it states MediConnect, but still says to bill Medicare first.
Yeah, I think that's the same question we've answered. On this one where it's Cal MediConnect, it is Cal MediConnect. I understand what it says on there. This is a problem, again, with the state ABS system. But when you see that they are HMO Medi-Cal only, and then you see bill Medicare, bill Medicare.
Here we have another one. Both say the patient has Medicare parent and A and B services to be billed first. How do we know which is fee-for-service or HMO?
Okay, again, if it says Part A and B Medicare covered services on the ABS system and doesn't say Cal MediConnect, those services are all fee-for-service. The better way, like I said before, to be 100% sure of that, have your staff quickly go to the Noridian website, run the patient's eligibility. It will tell you accurately for that day whether the patient is in the Medicare program and currently eligible, or it will say Medicare HMO risk, which means they have been assigned to an HMO.
Okay, another one here. What should we do if the HMO is continually not paying after Medicare up to the Medi-Cal allowance for SUPARTs, MRIs, etc.?
Okay, that's exactly where you need to get some help. And if you are a member of CMA, we are looking for those. If you have instances like that, we want to hear from you because we're building the case for why this program is not working. The secondary entity, again, is responsible for payment for those services. If you've not gotten on a crossover, bill them on paper. If that doesn't work, turn them over to the CMA. Even if you're not a member, we'll take them from you. But unfortunately, the CMA will not be your advocate in dealing with the plans in that situation.
Okay, another one here. Please give example of services that may be required to authorization not covered by Medicare.
Yeah. I would say that anything that you're going to do outside of your office, you shouldn't need an authorization, but the plans have been a little bit sketchy on this, and the Department of Healthcare Services, which oversees this, has also been sketchy on what they really meant by this. If you're doing something that has a significant cost to it, I would tell you contact the secondary payer, the Medi-Cal payer, and tell them this patient has fee-for-service Medicare. We're going to use the Medicare as the primary, and we're going ahead with this. Is that okay? You should be fine. If you have examples where after the fact they're saying no, we need those from you.
Other question, if we are not contracted with the HMO that the patient has signed up with, will we still be paid by Medicare, just not Medi-Cal?
Okay, I'm going to bring that question right to the top. If the patient is fee-for-service Medicare and they are only in an HMO for the Medi-Cal portion, you will be paid by Medicare. If the patient is an HMO Cal MediConnect for all services, you will not be paid by Medicare. They've already shifted that responsibility downstream. And if you're not contracted, don't take care of the patient outside an emergency.
Another question, what if the HMO will not give authorization for the patient that does not have Part A coverage? Should we not see the patients did not have Part A? We are an orthopedic practice and keep running up against this problem. What about continuity of care?
Okay, two good questions there. If you are running up against that, I would really love to hear from you directly, whether you're a CMA member or not. I hope you are. But if you're not, we really need those examples. In that Part A thing where you're going to an operating room, there are issues with the fact that they do not have a fee-for-service coverage for Part A, and therefore they are 100% managed care for their Medi-Cal. likely the plan is correct and saying that they're not responsible, and you would have to transfer that patient to someone with a contract with that secondary payer or get a fee-for-service contract for that individual patient. The second part of your question is continuity of care. When this program first rolled out, there are continuity of care guidelines that are available online or through the California Medical Association. I think the site was called californiaduals.com that the state had put up. I'm not sure if it's still running. There are definite requirements. If you're in the midst of care when the patient rolls over into Cal MediConnect, the new entity is responsible for the care during the acute care period, much like anybody who's changing plans in the midst of acute care. But that has to be acute care. First of all, global period doesn't matter. It's all covered by whatever you did. But beyond there, once that patient is stable, they do need to be transferred.
We have another one here. Will we receive a recording of this webinar, slides and audio? Well, absolutely.
Yeah, that's the intent of this. This is the live one. You guys get it first, and I thank you for the questions, which really help fill it out.
Great. Well, Dr. Mazur, thank you very much. That's all the questions that we've had come through. Yes, the recording will be available in about a week. The slides will be sent out tomorrow via PDF. And we'll also, if there's any other questions that come through afterwards to us, we'll forward them to you, Dr. Mazur.
I'm just curious whether we can redo the poll at the end of this and see, because the poll questions, the way they were
let's share the results right now. Okay, here's the results from the 3 poll questions. We're sharing the first one. There's the...
So further the question, must I have a Medi patient sign up with a dual plan with which I participate to continue to see him? You guys did good. 86% are correct, saying no.
All
next
right.
question.
We'll go to that next one. Here we are.
Do I need authorization to see the patient with fee-for-service Medicare but enrolled in managed care MediCal? You guys split. I hope you know the answer now is, generally speaking, the answer is you do not need authorization from the managed care MediCal plan.
And the last one.
Must I contract with the managed care MediCal plan in order to see the patient who has opted to retain fee-for-service Medicare? 63% of you got it wrong. No, you do not have to contract with them. You can see them under the fee-for-service Medicare benefit, and the managed care MediCal plan is obligated to pay the secondary payment as if they were MediCal.
Great. Well, thank you again, Dr. Mazur. Thank you, everybody, for attending today. Again, everything will be sent out to you tomorrow for the PDF slides and next week for the recording. Thank you, everyone, and have a wonderful day.
Thank you.
Thank you.